Welcome to the Rare Wellness Podcast. Wellness is a rare treasure hidden in a maze of daily challenges. In this podcast, we illuminate uncommon pathways to health and vitality, exploring cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments of 5 minutes or less. I'm your host, Dr. Jamie Lewis, and today I'm joined by Dr. Howard Gratton, and we're going to discuss how to choose a regenerative medicine clinic. This podcast is brought to you by Northwest Center of Regenerative and Performance Medicine, located in the beautiful Pacific Northwest. Visit us online at www.nwc4rm.com. And before we begin, a quick disclaimer: this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare professional for any medical concerns or treatment. Today, I'm joined by my colleague, Dr. Howard Gratton, and we've both spent years working in regenerative medicine, and we've seen the best and the worst of what's out there. So today, we want to help you cut through all the noise in choosing a regenerative medicine clinic.
Patients are bombarded with ads and promises, but not all regenerative clinics are created equal. And one of the clearest ways to explain it is to kind of think of it like restaurants.
Let's break it down into 3 types using that restaurant analogy and show you what you're looking for. So at the top, you have grade A clinics, and these are like your Michelin-starred restaurants. These are clinics where every ingredient is selected and measured based on your unique condition. It's not guesswork. It's a custom tasting menu built just for you using real science.
And here's the critical difference. These clinics show you the data. We're talking about large-scale outcome tracking on thousands of patients, not just a few hand-picked testimonials. That level of transparency tells you they take the results seriously.
And the way to get these great results is by being supported by a fully equipped lab, which means they can optimize your platelet or stem cell dose based on the current research and for your specific condition. They'll also measure cell count and viability to make sure that you're getting the dose you need for the outcome that you're looking for.
And it shouldn't stop there. Grade A clinics usually take a whole person, holistic approach. That means they're looking at the metabolic issues that are often driving pain and inflammation, like insulin resistance, poor sleep, or hormone imbalances, or muscle weakness. They're treating the soil, not just watering the leaves.
That's a great analogy. And plating also matters too. Treatments are delivered with precision using ultrasound or fluoroscopy guidance so that your cells are delivered exactly where they're needed.
Now let's compare that to grade B clinics. These are your like fast casual chains, quick, convenient, but cookie cutter. They use automated machines to create the same cell product for everybody. You'd commonly find this in or orthopedics office or a pain management physician who has just casually added on regenerative treatments without really digging into performing the highest level.
Right, so these are done without a full lab support, no dose tracking, no customization, the same dish, whether you're 25 with a tendon injury or 70 with severe arthritis. And the machines that they use are vary widely in quality. Some don't even meet the minimal standards for creating platelet-rich plasma.
And the meal might taste okay at first, just like at a casual restaurant, but it's not going to be memorable that you're going to look back on fondly because these clinics usually have no real outcome data, just a few success stories cherry-picked for the brochure.
And then we get to the grade C clinics. These are places promising miracle cures using fetal tissue, amniotic fluid, or cord blood.
Yeah, they're selling you a chef special, but when you open it up, it's basically just a frozen TV dinner in a shiny box. These products have no living stem cells, and the FDA has made it clear that they're not regenerative.
Even worse, these treatments are often given intravenously without imaging guidance by providers with little or no specialty training. And yet they're charging premium prices, sometimes even more than grade A clinics.
So they have no lab, no dosing, no tracking, no imaging, just a slick pitch and a high bill.
So if you're considering a regenerative medicine treatment, ask your prospective clinic these questions. 1, do you track outcomes? And do you have large data sets of numbers of patients that you can show outcomes for the areas that I'm interested in being treated? Do you use a full lab for a customized, optimized treatment? Can you show me the cell counts and viabilities of what I'm getting? Is my injection guided by imaging? Will you address other root causes of inflammation and poor healing?
If the answer is no to most or any of these, you're not going to be at a grade A clinic.
Thank you for joining us today on the Rare Wellness Podcast. If you found value in today's episode or learned something new, please subscribe, leave a review, and share this podcast with a friend. Your support helps us to continue to provide free content to empower you on your journey to better health. I'm Dr. Jamie Lewis with Dr. Howard Grattan, reminding you that your body holds an incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential. We'll see you next time.